All right, Linz, thank you so much. We are continuing our effort to answer your questions about the coronavirus.
That's right. We're joined once again live via Skype with Dr. Dana Hawkinson with the University of Kansas Health System. Doctor, as always, thank you for waking up early with us, spending some time. We know you're busy. The CDC is deciding right now whether or not to recommend people wear face protection when they go out. We see people anytime we go to the grocery store, especially right now, wearing those masks. Is that necessary? Does it create a false sense of everything's okay if you're wearing that mask? Talk about that.
Yeah, that's a good question. You know, it's been consistent that the CDC has said that if you're well, you don't need to wear a mask. And that still holds true. The problem is now we think that there are times if you have the infection, you could be asymptomatic. And with that, you could be spreading the disease. So that's one of the reasons they've gone or considering doing that. But I think more, like you touched on, can it offer a false sense of protection and safety? Absolutely. If you're wearing a face mask, if you're continuing to manipulate it with your hands, you're putting your hands in your face, and certainly that poses an infection risk. So you're absolutely right.
And Doctor, we're all working to honor that stay-at-home order right now, but when we do go out to get necessary items, when we come back to our home, we talked with you earlier about wiping down what you may have bought. Do we need to be wiping down things like our shoes, showering when we're back at home, like ourselves?
Well, I think the most important thing to do once you get home is wash your hands because you are out touching everything else. And then once you get home, you could certainly bring it into your environment. On the way home from the grocery store, make sure not to touch your face because you've been out in the store and you don't know who came before you, the 10 minutes before you. Certainly we know the virus is easily spread and is highly contagious and permeates through the community at this point. Other measures such as taking off your shoes and other things, again, I think it's okay to be and have an overabundance of caution. So I would never say no to that, but I think still the most important thing to do is to wash your hands and make sure that you aren't touching your face until you can get home and wash your hands and do those things. So I think if you want to take your own measures as an individual and be overcautious, I'm certainly all for that.
Doctor, one more question for you this morning. We are trying to keep up with social distancing. Most people are, but we're also craving any kind of human interaction we can have with people that live outside of our own homes. People having the driveway hangouts, that kind of thing, with other members of their neighborhood across the way. Is that okay? Is that safe? What's the best way to do that if we want to spend some time outdoors with people not in our family?
Yeah, I certainly think that's okay. I would really encourage, however, to stay 6 feet or more away, 6, 8, 10 feet. Probably not groups of any more than 4 or 6. If you have a couple or a few couples that live in your neighborhood, and maybe that's what you're describing, I would keep the group as small as possible. I would really maintain a 6, 8, 10-foot distance. Certainly don't share any foodstuffs or any drinks or anything like that. I think that would be okay. Because, yeah, certainly we all need other social interactions. We all aren't lucky enough to be able to come to work every day and interact with other people. And this is really hard emotionally and psychologically as well as physically for a lot of people doing this. But it's still the right thing to do. This is the way that we are able to stop the spread of the virus.
Dr. Hawkinson, can I ask you on that same note for family members, if they're grandparents who are younger, much younger than 65, can you go see in small groups family members if you stay outside and you stay far apart?
Yeah, again, I think that still goes to the social distancing, the physical distancing we just talked about. I think if you're outdoors and you're not in an enclosed space, I think that's okay. Again, keep the group small, especially, grandparents are going to want to be hugging and kissing their grandkids. I probably would not do that. We do have to physical distance, but I think just seeing, a loved one or a family member in that manner, I think that would certainly be okay. But we have to, again, keep in mind our physical distance and not touching, and certainly. Not having, we know children can have the infection and have the disease without even really knowing it or being too ill, and can spread it to others. So I think maintaining the physical distancing, I think, is key.